We're recording. We're going to start and finish chapter 9 today. There are, I think, 32 slides, and this is about contraception and abortion. Now, as I've said in the past, if you do not feel comfortable participating, if you don't feel comfortable even hearing about these things, I understand and I relieve you. Be gone. Okay? Okay, so I'm going to share my screen. Does anyone have any questions about anything before we begin? About anything. I really enjoyed our conversation on Tuesday. Thought it was a good one.
Did
Yeah,
you?
it's fun.
Yeah, like I said, I want to do that every week. I think depending on the chapter and how much we have to cover, I think we can afford to do that every single week.
Mm-hmm.
Okay. Contraception and abortion. Let's get it going. Birth control has a long history. The ancient Mediterraneans killed, abandoned, or what does it say? Oh, killed, abandoned, or neglected. Oh, or sorry, I'm sorry. Yeah, that would be or neglected unwanted children. Okay. Uh, the withdrawal method was noticed in the Bible. The pull-out method. So it says in the Bible, Onan spilled his seed upon the ground to avoid impregnating his dead brother's wife. Male condoms in the beginning were made from intestinal tracts of non-human animals. This is during the 1700s. Diaphragms, which is another barrier method, were made out of half lemons in the 1880s. Mm-hmm.
I feel like that would burn.
Um,
What the heck?
yeah, well, uh, maybe it did.
Is that
Yeah,
on purpose?
to burn it.
Yeah.
Well, no, I don't think that was. No, it was a barrier method. It was supposed to like they kind of hollowed it out like a diaphragm. We'll get there. You'll see. Because it would kind of go around the cervix kind of thing.
Like a diva cup?
Yeah, yeah, yeah. So feminists led the campaign to legalize contraception. We know about Margaret Sanger. And we know that she led the struggle to legalize contraception in the 20th century. It hasn't been solved. Uh, it hasn't solved the problems of unwanted births, however. 90% of women who are 15 to 45 are using some form of contraceptives, but only 44% of births are wanted. Now, wanted is a different word, right? We should go with planned, but your text says wanted. Maybe it's also unwanted. Who knows? Okay. So when we use contraceptives, we have what's called a perfect use failure rate and a typical use failure rate. So perfect use means that you're using the pill every time you're supposed to. You're using a condom every time you're supposed to. You're using whatever. So that's a perfect use. But even that is about 99% successful. The typical use, though, and this is where, oh, we can not wear a condom today, or, oh, I didn't take my pill on time. I'll take it, whatever, whatever. So the percentage of women using contraceptive technique with a typical degree of care who will become pregnant in a year is 8%. So using the pill for the normal person, 92% chance of not getting pregnant, or 8% chance of getting pregnant. If you're using it perfectly, you have a 1% chance. Um, I don't know why I put this in here really, but it's a pregnant woman who's smoking a cigarette, and it says that she's worried about the effect on her unborn child from the sound of jackhammers. I don't know. So physical methods block sperm transport. So male condoms uh, are reliable when they're properly used. It's a disposable sheath that is placed over the penis before coitus. This is a barrier method. That means it's a technique in which a physical barrier prevents sperm from reaching the ovum. It does provide against STDs and pregnancy. Comes in many sizes, typically about 7 inches long by 2 inches across when flat.
I thought those were vegetables on the bottom.
Ratatouille.
Or slices of tomato.
Why are condoms colored?
I think it's just to make it fun.
All
I was
right.
just gonna say that they probably will buy it if it's fun looking.
It doesn't, yeah, it doesn't have obviously any impact on the effectiveness whatsoever.
Wait. What about
Wait,
flavored ones? Aren't
whoa,
those
whoa,
bad now or
whoa,
something?
whoa. Are they bad?
I thought they were bad. Like you weren't supposed to. I thought they were bad. Like they weren't good for like intercourse or anything because it can like imbalance the
Okay.
pH. I don't know.
Yeah, I haven't heard that. I haven't heard a lot about flavored condoms as
I've
of
heard a lot
late.
about them.
Well, I mean, I've heard about them, but I'm saying I haven't heard of them recently.
Oh,
So maybe that's why. Maybe that is causing a problem.
just thought I'd share that.
Thank you. Well, look it up then. And tell us. Female condoms are relatively intrusive. It's a plastic pouch that's inserted into the vagina and as a contraceptive and or to prevent disease transmission. You can see here they're taking it and they're kind of folding it here and they're kind of squeezing it up into the vagina, pressing it up against around the cervix. Now this is a complete tube, completely sealed, and then the other half sticks on the outside like this, and this prevents um, like a regular condom.
Question again.
Yeah,
I can't raise my hand in here, but do a lot of people use that still? Like, do women use that? Do you know percentage of how many women use that still, or
I know people still use it. I don't know what the percentage is. If I had to throw
is
just
it,
a guess out there, it would be pretty low.
yeah, like 1%?
Fewer than 1% would be my guess. Now here's the diaphragm. That would be like the half lemon, right? Um, and cervical caps are inconvenient but have few side effects. It's a barrier that's placed over the cervix as a contraceptive. It's used by fewer than 1 in 50 women, but it also, and this is the reason you don't want to, but just somebody you don't know well, or if you're in a new relationship or not a committed relationship, there's very little disease protection.
Wouldn't the lemon decompose?
I think you take it out,
Yeah, but
but you have to leave it in there for a while.
yeah.
Yeah. Spermicides are not very reliable when used alone. A chemical that kills sperm, available as a contraceptive in a variety of forms, such as foams, creams, and suppositories, meaning these little pills that you stick up your vagina and it dissolves, just like you would take like a capsule for the flu or something. The noxinol 9 is the ingredient that kills sperm. Um, the suppositories need at least 10 minutes before coitus to allow for the dissolving, and it must be kept in place for at least 6 hours after coitus. So that means you can't clean your vagina afterward for at least 6 hours because you could be taking out the chemical and leaving in some sperm. An IUD or an intrauterine device requires little attention. It's placed into the uterus as a contraceptive. It's not completely understood how this works. Some think that it's thought to inflame the uterus and interfere with sperm passage. It's inserted by a trained healthcare professional. Paragard can be left in for up to 12 years, and Mirena for 5. So here's the copper one here, and then here's the hormone releasing one here.
If it's not completely understood, then how and or why is it up there, and how did we figure out that that was going to work?
I haven't a clue who came up with it. I haven't a clue. Nope. No
Because I
idea.
mean, who thinks that's a good idea to wrap copper around a little fish hook and stick it in a
Yeah.
lady's vagina?
Yeah. It looks like a grappling hook for like a He-Man figurine.
Ooh, maybe it was playtime taken to the extreme.
That-
He must explore cave.
Yeah. It's got to be something. Yeah. Hormone-based methods are easy to use. We have the combination pills that offer health benefits. The constant dose combination pill is an oral contraceptive regimen in which the pill contains the same drug dosage and they take it for 21 days and then a a placebo, for 1 week. This allows for a period. The triphasic combination pill, the regimen that varies the dose of estrogens and progestins around the menstrual cycle. And this, as a result, will decrease side effects because
I
it's
have a
mimicking
question.
more of the natural cycle. Yeah.
So the dummy pill, you don't actually have to take that, right? It's just for you to remember.
Yeah.
Okay.
Right. You don't have to.
I thought.
It's so you can keep track of how many days have passed before you have to go back to the next one. Yeah. The continuous use of combination pills eliminates menstrual periods. This can take the menstrual period up to 4 times a year. I'm sorry, it can time the menstrual period to 4 times a year only by taking the pill continuously, but there's no clear evidence of health risks. So, unlike this one here, the constant dose that's taken out, or I should stopped, if you continually use it, it'll eliminate it. But you're supposed to at least time it to 4 times a year. Progestin only pills have fewer side effects, very low doses of progestin. It works mainly on cervical mucus. It makes the mucus in the cervix viscous and hostile to sperm transport. Each pill lasts approximately 24 hours, so must be careful not to miss a day on this one. It's not like the other ones where you have estrogen and progesterone, where it lasts longer. This one is very low dose, doesn't last long. Depo-Provera shots. This lasts 3 months each administration. The drug that is delivered intramuscularly and used as a contraceptive in women or to decrease the sex drive in male sex offenders. So it has
What? So it's given to the same kind of drugs given to both?
yep, because it's a estrogen-based drug that lowers sex drive in men.
But it doesn't to women though.
No. We have the transdermal patches that last 1 week. They contain a store of hormonal contraceptives that diffuse slowly into the body through the skin. An example would be Ortho Evra. So the hormones, to cover it all so far, let's see. Yeah, okay, we're not done yet. But so far, we have hormones administered through pills, hormones administered through IUDs, hormones administered through shots, hormones administered through patches. And now we have hormones administered through vaginal rings. These last 3 weeks. The Nuva ring is an example. It releases estrogens and progestins. It's a flexible ring about 2 inches in diameter. It's kept in for 3 weeks, then removed to allow for a period, a menstrual period. Another one, implants. These are the rods that contain contraceptive hormones placed under the skin, such as Implanon, that lasts up to 3 years. Yeah, I know, it gives me the heebie-jeebies too.
Actually, I had a friend that had one, and she had a horror story. Like, she's also got everything known to man wrong with her, but she had that in, and apparently her scar tissue fused with it, and her thing busted open, and it was just an absolute like bloody mess, and she can't do it. It apparently, like, it's a very low percent, or not low, but it's lower percentage of women who just can't tolerate it, and it just so happens that she has like if it can go wrong, it will go wrong, and it did.
Ugh.
Now she has like a huge scar from it.
Oh man, it just makes my stomach like, ugh.
Ugh, glad I'm not a girl.
So, behavioral methods are demanding, right? In fertility awareness methods, couples try to avoid the fertile window when having sex. Nearly all pregnancies occur during that 6-day ovulation window. And sometimes it's difficult to predict when women are ovulating. There's something called the standard rhythm method, where 75% of women 75% of women use this. And day one they say day one is when the menstrual period starts. And then on day 8 to 19, they abstain from coitus because that is somewhere in that 8 to 19 is where their ovulatory window is. Then there's the calendar rhythm method, which is complicated math following 6 to 12 cycles. There's a cervical mucus method where they observe the changes in the mucus. There's the temperature method, body temperature method called the symptothermal method. Most people use the standard rhythm method, and that is simply, here's your period. You got your period. It lasts for so many. We can have sexy time for a couple days, but that's it. Around, between 8 and 19, we shouldn't be touching each other. That gives us a nice, safe window. But then, 9 to 28, whatever. So the withdrawal method is simple. Like if the male just pulls out before he ejaculates, but it comes with a 27% failure rate. Part of it's because of pre-ejaculatory fluid that can hold sperm. So if he ejaculated earlier and has not urinated since.
Oh,
But the
oh.
usual problem is that he usually does not pull out in time. It's just getting to the peak. Non-coital sex can be used as a means of avoiding pregnancy. Masturbation, oral sex, anal sex, kissing, fondling, right? Outer course, that's where you do the dry humps. Emergency contraception, a high dose contraceptives after unprotected sex to prevent pregnancy. This will prevent ovulation. The sooner you use it, the better it works, and it can work up to 5 days. This is also known as
Plan B.
Yep, Plan B. Sterilization is highly reliable. Surgical sex to eliminate fertility in either sex. The sterilization. A vasectomy, the male sterilization that involves cutting or tying off the left and right vas deferens. Tubule sterilization is female sterilization involving cutting, cauterizing, or tying the oviducts. We call this tubule ligation. Tying, ligate means to tie. Vasectomy is a brief outpatient procedure, usually performed under local anesthesia. There's a small incision in the scrotal sac, cutting off the vas deferens and either tying, cauterizing, or clipping to not allow them to reconnect. Or you could use a small, sharp set of forceps that pierces through the skin, requires no scalpel, heals faster, and on average it's $250, $300. Very different from a tubal sterilization. It's more invasive and also more expensive. You need a laparoscopy, where the abdominal surgery is performed with a laparoscope, which is a little camera through a fiber optic viewing instrument. There are no stitches. A mini laparotomy is abdominal surgery performed through a small incision in the abdominal wall, and this does require stitches, and this runs between $1,000 and $6,000 versus 250, 300 versus no real surgery versus surgery versus local anesthesia versus general anesthesia.
And then men have it easier.
And then versus, I'm trying to point that out, outpatient versus inpatient.
I had my tubes tied when I had my last daughter, so I was lucky to have my C-section at the same time. But it's still, even the after effects of having a tubal, it's not fun some days.
Yeah, sure.
So yeah, you guys have it easy.
There are, so it's not all easy. Let's not, paint the wrong picture.
No.
There are some people who have vasectomies who are in scrotal pain for months.
Oh, yeah, it can go terribly, terribly wrong. We had a gym guy that had his done, and he was like, I'm done with kids. And one of his testicles was so inflamed for months, and there was nothing they could do for the pain. They just had to wait till the swelling went down, and they had to go back in and redo something. But I saw a picture of it, and I love testicles, but I didn't love that one.
You saw it in the sack or in the open?
Oh no, like he showed me, and I was
Oh.
like, I don't think it's supposed to be that color because it was like really purple,
Oh.
and it was just one. The other one was completely fine. It was like twins. This one super duper happy, everything's fine. This one mad, angry.
Mm.
I've never loved my balls so much.
hmm Disabled persons have special contraceptive needs. Mentally disabled women usually are given the progestin hormone injection. The physically handicapped women are suggested to not take oral contraceptives because it may increase their chances of blood clots, which could lead to strokes, heart attacks, that kind of.
Hmm.
Okay, so now we're on to abortion. This could be
Wait.
yo
We're done. We're done
contraception.
contraceptives now, right?
We're done with contraception. Yes.
Okay, I wanted to ask you a question then real quick.
Yeah.
So why can't so is that the reason why people over like 35 and that smoke can't take the pill? Is that because it'll cause like
Yeah, it causes problems. Yeah.
yeah, that's crazy because like my mom can't take anything at all. Like she can't take anything now to help her.
That's not true. You can. Let me take that back. I don't know what your mother is. What's going
Yeah,
on?
I know. She can't take the shot. She can't do the patches. She's like allergic. So
Yeah, she can't take a contraceptive. You mean?
yeah,
But there are hormone replacement therapies that are actually highly recommended for women.
really.
Once they reach, yeah. Because if they don't take hormone replacement therapy, if they're premenopausal or menopausal or postmenopausal, then what happens is their bone the estrogens are responsible for bone density
Mm.
and also temperature regulations, a whole bunch of stuff with progesterone.
Okay, I just wanted to ask because the contraceptive thing is like the pill thing is really weird to me. Like how like
Yeah.
over a certain age it like really
Yeah.
messes you up.
Mm-hmm.
Okay, thank you.
Yeah, sure. I mean, the reason being is that it's mimicking something that shouldn't be there.
Yeah.
So, now on to abortion. So, an induced abortion is performed intentionally by medical or surgical means. You should definitely know the difference between a therapeutic and an elective abortion. A therapeutic therapy, right? Performed to safeguard the woman's life or health. It has a medical reason. Elective abortion is where they are opting. There is no health risk. They're electing to have an abortion. There's the vacuum aspiration. That's the first standard. I'm sorry, that is the standard first trimester surgical method where the conceptus is destroyed and removed by suction. This method accounts for the majority of abortions. It's an outpatient basis with local anesthetic. It takes less than 5 minutes. Complications are rare, and the women are advised to abstain from coitus for at least 2 weeks. There's the dilation and evacuation. This is used early in the second trimester. It employs both a vacuum aspiration followed by the use of instruments to remove any remnants of the conceptus. A lot of it's going to be the amnia, the placenta. This is usually performed between the 13th and 16th week. Women are usually sedated. It's usually a 2-day procedure. On day one, they are ingesting or they're inserting, a stick made up of seaweed called laminaria into the cervical canal to dilate the cervix. And then day two, they're going to remove, using suction, any fluid and tissue that's lining the uterus.
I have a question.
Mm-hmm.
So by vacuum, like, do you mean like they kind of just like put it up to the vaginal opening and just like suck?
No, they go up through the cervix.
Okay.
Yeah, it's up the vagina, through the cervix, into the uterus.
Like an actual vacuum, like not like a household vacuum
Dyson.
thing.
Yeah.
Yeah, like it's like a long tube thing, or is it like?
Yeah. Yes.
Is it bendy?
Is it bendy? I don't know.
I just
I'll be
wanted to
honest,
know.
I've never seen one done.
So I had to have an abortion once. unfortunately, it was housewives. They do stick up. It's bendable.
Yeah.
Yeah, it is. It's not like really. It needs to bend to go with you. So yeah,
I just wanted to know that because it sounds like really uncomfortable.
it's very uncomfortable.
Yeah.
Induced labor and hysterotomy are done late in the second trimester, where they'll inject a strong salt solution into the amniotic sac. The hysterotomy is performed by a surgical incision in the abdominal wall and the uterus. Medical abortions are a two-step process that can be performed anytime up to 7 to 9 weeks. They'll use what's called mifepristone, which induces abortion. It blocks progestin receptors, which is necessary for maintaining it. And then they will then use misoprostol, which induces contraction. So it's like baby, you're giving birth essentially. Abortions do not cause long-lasting ill effects. They're no long-lasting depression or stress. It says about 1% of women will experience any lasting depression or stress from an abortion. And oddly enough, women tend to show an increase in self-esteem. You would think that there would be something, the inclination would be, oh, they're going to be really upset for a very long time. And they are upset, but there's no long-lasting upset in this. And the boost in self-esteem, they've gotten essentially, they were challenged. They had a reason to do it. They're not doing it because it's fun. They're not doing it because they like to do it. They're afraid, and they're avoiding something for one reason or another. They're avoiding death, certain death of the baby, certain death of the mother. They're avoiding giving birth to an unplanned being, and early enough, whether you're pro-life or pro-choice, that's your choice. That's up to you. Okay. But the fact of the matter is, early abortions, and even abortions up to these dates, there's no functioning nervous system in the sense where there's thinking or feeling. There is nothing like that. It's a cluster of cells. It's a mass of cells. Oh, that was it? Oh, okay. All my classes have been short today. I'm gonna stop recording. Wait,
That's it.